Acute kidney diseases in dogs and cats. For the general signs, in mild cases we can see anorexia, polyuria, polydipsia, dehydration and vomiting. In severe cases we can see uremic coma, seizures, and hypertension-induced blindness and anemia. For diagnosing acute kidney disease, the three legs are blood tests, imaging, and urine analysis. In the blood tests we can see increased urea, creatinine, and SDMA due to the decreased glomerulus filtration rate. For the imaging, we look at ultrasounds of the kidney size and see if there's any obstructions. In the urine analysis, we can see iso or hypothenuria and proteinuria and sediment. The types of azotemia are prerenal, renal, and postrenal. Prerenal azotemia is from dehydration and it's reversible. Renal azotemia is from nephron damage due to toxins and ischemia. And postrenal azotemia is from obstruction or leakage. There are 4 phases of acute kidney injury: initiation, extension, maintenance, and recovery. In initiation, this is early kidney damage. In extension, this is inflammation or cell injury. In maintenance, this is impaired filtration and it can be fatal. For recovery, there will either be regeneration or the disease will progress to chronic kidney disease. The causes of acute kidney injury are toxins, infections, and ischemia. The toxins include NSAIDs, ethylene glycol, lilies for cats, and grapes and raisins and heavy metals. The infections include leptospirosis and pyelonephritis. And ischemia can be caused by hypovolemia, sepsis, or trauma. In the early clinical signs, we can see lethargy, polyuria or oliguria, and painful kidneys. In the severe clinical signs, we can see uremic ulcers, seizures, and coma. And when doing the diagnostics in the blood, we can see azotemia, hyperkalemia, and metabolic acidosis. Treating acute kidney injury, you want to restore perfusion, so give an isotonic crystalloid for shock. Correct any oliguria or anuria by giving mannitol or furosemide, but first you need to make sure they're hydrated. Managing hyperkalemia, in mild cases, give potassium-free fluids, in moderate cases, give glucose and insulin infusions, and in severe cases, give calcium gluconate for cardiac protection. Specific conditions of acute kidney injury are ethylene glycol toxicity and leptospirosis. In ethylene glycol toxicity, they get polyuria and polydipsia for about 30 minutes to 12 hours, and then they get acidosis for 12 hours to 1 day, and then they can get acute kidney injury for between 1 day and 3 days. For the treatment, have early emesis, so make sure they vomit, and give ethanol as an antidote, and dialysis. In leptospirosis, the signs are fever, dark urine, jaundice, and renal failure, and the treatment is doxycycline and supportive care. For the prognosis, with grades 1 and 2, it's favourable with early treatment. With grades 3 to 5, there's a high mortality and they become worse with toxins and infectious causes.